So the fourth important group of drugs, and they are called biguanides. These are called biguanides, and the two important biguanides are, one is called the metformin, and one more is the penformin. So one drug is called the metformin and one more is called the penformin. Now the metformin and penformin, in that only we have metformin. Penformin is been withdrawn because it has caused severe lactic acidosis. So because of severe lactic acidosis, it has been withdrawn from the market. So what we have, the wonder drug is metformin. Now what is the mechanism, how it helps in diabetes? Metformin is known to inhibit an enzyme called AMP kinase. So it inhibits an enzyme called AMP kinase, particularly in the liver. And what happens when it inhibits this kinase, AMP kinase? It is responsible to decrease glycogenolysis, and also it increases glycogen synthesis. It increases glycogen synthesis. And third, what happens in the periphery? It increases insulin sensitivity. So it increases insulin sensitivity. So it inhibits AMP kinase in particular liver, and in the periphery it increases insulin sensitivity. Now penultimately what happens in the liver? The glycogen will not convert to glucose, so this will decrease hepatic glucose output. So there will be decrease in hepatic glucose output by metformin. So metformin is going to decrease hepatic glucose output, and also it is going to increase insulin sensitivity, and that's the reason this drug is used in the treatment of PCOD also. Now what happens in polycystic ovarian disease? There is insulin resistance, obesity, all these things are there. So that's the reason it increases insulin sensitivity. We use it in treating PCOD. Now when you know the mechanism of action, now where do you use this drug? One is, as you know, that this can be used in the treatment of diabetes type 2, and also this is used in the treatment of polycystic ovarian disease. And in diabetes, this is the one of the drug which is known to decrease both micro and macrovascular complications. It is the one which is going to decrease both microvascular and macrovascular complications, and that's the reason it is called wonder drug for diabetes till today. Now, do we have any problem with the drug? Now, the most common ADR what we face with the drug is the GIT upset. Patient will have the GIT upset. So GIT upset will present as nausea, vomiting, bloating, and abdominal pain. So this is commonly reported by the patients. Another important adverse drug reaction is it is known to cause megaloblastic anemia. It causes megaloblastic anemia. And this megaloblastic anemia is due to B12 deficiency. So it is because of B12 deficiency. And one important dreaded complication is it is also known to produce lactic acidosis in certain individuals. Now, what are the risk factors where the lactic acidosis increases? What are the risk factors? This is also being asked in AIMS exam. Now, the risk factor depends where the lactate is synthesized more. Now, where there is increased lactate production is seen in conditions such as sepsis, hypoxia, and in CHF conditions, this lactate production is more. Another condition is when there is lactate, the lactate may not be removed properly, defective lactate removal. Now, when does this defective lactate removal occur? This will occur whenever there is liver failure. Whenever there is liver failure. Now, another issue is when there is increase in metformin levels. Now, whenever there is increase in metformin levels, this will also lead to lactic acidosis, and that is seen in renal failure. So metformin is eliminated by kidneys, and if they fail to eliminate it out, the metformin level increases and the risk of lactic acidosis increases. So what are the risk factors for this? One is sepsis, hypoxia, CHF, liver failure, renal failure, and in advanced age, that is in elderly, advanced age group, the liver failure and renal failure is also seen. So the advanced stage is also a risk factor for them. Same thing was asked in one of the AIMS exam. They had given liver failure, renal failure and advanced stage. Along with that, they had given smoking as an option. Smoking doesn't increase the risk of lactic acidosis. Now, whenever you give metformin, always you should monitor the renal function. Now, when you have to reduce the dose, you have to reduce the dose when the GFR is between 30 to 45 ml per minute per 1.73 meters square. At this level, you have to reduce the dose. And when you to stop metformin, if the GFR is less than 30 ml per minute per 1.73 meters square. At this time, you have to stop metformin, otherwise it will accumulate and increase the risk of lactic acidosis. So that's the reason renal failure, you should be very importantly monitoring that. Suppose if there is increase in serum creatinine levels, so that is also a marker for renal failure. In that case also, you should stop metformin. And same question was asked in one of the AIMS exam. A patient comes with high serum creatinine, that is 3. Now, which of the following drugs should be stopped immediately? And that is nothing but metformin. So metformin has to be stopped immediately in this case. So that is about the wonder drug metformin, and that belongs to biguanide.